When many patients go to the doctor's office for a wellness exam, they forget to talk. Well, it's true. Many patients forget to share and have an open dialogue about the things that are bugging them. Well, Dr. Christopher Tukey joins us this morning to discuss. Good morning, Dr. Tukey. Welcome to Daybreak.
Good morning. Thanks for having me.
Well, welcome. So what are patients forgetting to share when they come to a doctor's office, Dr. Tukey?
Well, as you mentioned, a lot of people have a lot they want to cover, and sometimes we get so excited about diving into our medical conditions, we forget the big life updates, and those can be a major factor. So whether it's the birth of a child, or maybe your significant other has had a major diagnosis, or you're caring for a relative, all these can really impact our health, and sometimes it's important to start there before we dive into the specifics.
And well, what should they be talking about when you're talking about specifics?
Well, in specifics, I think a lot of people say, oh, that's too trivial, I don't want to bring it up to the doctor, but a lot of little things can have really big impacts on our health. Even little things like heartburn at night can impact our sleep, or that nagging ankle pain, or there could be a spot on your skin you're worried about. All those things are important and definitely something that we want to address, because sometimes those can also tie back to some of our other medical conditions too. So I always tell my patients, if it's bothering you, make sure to let me know. Sometimes keeping a list can be really helpful because it's easy to start talking about one or two things and forget about the other 3 or 4 things. Just kind of be aware that sometimes we only have time for 1 or 2 things if they're really important, and we might have to have you come back for another visit.
So what about sharing information about their mental health? Is that also a time to share that?
Oh, I'm so glad you asked. I think that's one of the most important things that can come up during these visits, because our mental health impacts the rest of our health, and it's something that unfortunately we've seen a lot of people struggle with for a long time now. And thankfully, we really have a lot more resources now than we did before. And so talking with your provider about potentially getting in with a therapist, talking about a medicine, even looking at online apps and things like that to be helpful can all be some resources available for patients.
Okay, so when it comes to patients talking about their list items, is daily routines, environment also factored in?
Oh, definitely. In fact, many of my patients have a strong preference to avoid medicines, and I love that. And one of the best ways you can do it is looking at your daily habits and morning routines. If you can get a habit going of regular physical activity, that might be able to help you avoid a blood pressure medicine, for example. Or perhaps by cutting out some processed food, that cuts back on the salt and you don't need maybe a different medicine.
Well, I hope everyone takes your advice and advocate for themselves when they do their wellness visits. Well, Dr. Tukey, thank you so much for joining us this morning.
Thanks for having me.
Okay, and you can learn more about wellness on your News 19 mobile app or online at WXOW.com.